Hey guys, it's me, Professor D, and welcome back to my channel. On this video, we're going to be covering the family, okay? So I'm going to be covering questions on fundamentals of nursing, more specifically the family. If you haven't done so already, guys, please do not forget to like and subscribe below. I'm now on TikTok, so you can also check out Nexus Nursing on TikTok for different videos, different contents. They're not the same that I have on here, so make sure you guys go check me out over there. So without any further ado, guys, let's get started. First question. The family is a central institution in American society. However, the concept, structure, and functioning of the family unit continue to change over time. The uniqueness of each family is referred to as family: A, durability; B, resiliency; C, diversity; or D, forms. And the correct answer, guys, is diversity. And how do we know this? In the question, there was one key word that should have stuck out to you in the question, and it said uniqueness. Uniqueness as in something that separates something, that puts something apart, something that's different, okay? And that is diversity, not being the same. Now let's look at our other answer choices. We have one, durability. That is the family's support system outside of the walls of the home, okay? That's what the durability is. Resiliency, that is how well the family copes with stressors. Stressors such as illness, loss of job, anything that causes stress on the family, how well they cope with that. And then forms, what type of family are we dealing with? Are we dealing with a blended family? Are we dealing with a nuclear family? Are we dealing with a single parent household? Okay, so diversity, that is the uniqueness. And now I gave you what the other choices mean as well. Next question. Balancing employment and family life creates a variety of challenges in terms of childcare and household work for both parents. This has major implications in healthcare because A, maternal employment has been demonstrated to be harmful for the children. B, maternal employment has shifted the majority of household tasks to the male. C, fathers now participate more fully in day-to-day parenting responsibilities. Or D, the number of single-parent families has decreased since 1970. And the correct answer, guys, is C. Fathers now participate more fully in day-to-day parenting responsibilities. We're seeing a more sharing of the roles and responsibilities because now both of these roles are working, okay? Now let's look at the wrong answer choices. We have A, maternal employment. Stop. This is not the 1940s. Okay, or 50s, whatever it is. Maternal employment has been demonstrated to be harmful to children. No. Research after research has proven this incorrect. We are not in the 1950s here. Moving on. Choice B, maternal employment has shifted the majority of the household tasks to the male. I wish, but that's just not true. We find that the husband and wife or the married couples, they're sharing responsibilities more, but the responsibilities have not shifted from the mother to the father. That's incorrect. And then choice D, the number of single parent families has decreased since 1970s. That's wrong. It's actually gone up and it's still going up. Next question. A husband brings his children to visit the mother in the hospital. The nurse asks how the family's getting along at home without their mom around. The husband states, none of her jobs are getting done, and I don't do those jobs, so the house and the kids are falling apart. The nurse suspects that this family structure is A, very flexible, B, quite rigid, C, extremely open, or D, hardy. And guys, the correct answer is B, quite rigid. So mom is in the hospital. Yes, she used to do the cooking and cleaning, but she's in the hospital. So you're just going to let the kids starve and let the place fall apart. So the roles are quite rigid. That means there's no flexibility at all. Now let's look at our other choices. We have A, very flexible. That would be where the kids and the husband just jumped in and helped like nothing even happened, right? That's not what's happening here. Then you have choice C, extremely open. That's like the opposite of what's going on. And then D, hardy. That's where you see the internal strength of the family. And that's really not what we're seeing here. So we're seeing that those roles are quite rigid. It is essential for family members to realize that a family's beliefs, values, and practices strongly influence the health promoting behaviors of its members, and to understand that A, American families are part of the same culture with the same values and beliefs. B, economic status has little effect on families' ability to access adequate health care. C, family environment in early life has a strong influence on later health practices. Or D, all families place a high value on good health and health practices. And the correct answer is C, family environment in early life has strong influence on later health practices. So basically, guys, what that means is you do what you know. You know what you see. Okay, so these patients, they're going to do what they've been exposed to, what they saw growing up. Now let's look at our wrong answer choices. Choice A, American families are part of the same culture with the same values and beliefs. That's wrong. That's absolutely incorrect, okay? Because in American families, you have different races, you have different ethnicities, you have different cultures, you have different backgrounds, you have different beliefs, you have different morals, so many different aspects. So that is incorrect. Choice B, economic status has little effect on the family's ability to access adequate health care. If you've been following my videos for any amount of time, you know that is incorrect, guys. Having a stable economic background, having that economic stability, that actually opens more doors to healthcare access. So we know that's not right. We know that's wrong. And then choice D, all families place high value on good and health practices. Guys, I can't read. Let me go back. All families place a high value on good health and health practices. And that's false. That first word, all. Remember what I told you about all-inclusive, guys? That's incorrect because some families practice bad health habits such as smoking. And not only are they smoking, they're smoking in front of the kids, with the kids around, so the kids are breathing in that secondhand smoke. So we know that's not true, and that's why C is correct. Different approaches may be taken to family nursing practice. When the nurse is caring for a patient who needs constant care in the home setting and for whom most of the care is provided by the patient's family, what is the best approach for the nurse to take? 1, family as a context. 2, family as a patient. 3, family as a system. Or 4, patient as an individual. And the correct answer, guys, is family as a system, okay? Now let's look at our wrong answer choices. You have A, family as a context. This is when you're caring for just one member of that family system, okay? Then you have choice B, family as a patient. That's when all the family members daily are caring for one another. That's your family as a patient. And then lastly, you have your patient as an individual. That's basically where you're treating them outside of the realm of the family. So let's say you have a patient, but they have no family at all. Or let's say, they got in a big fight with their family 10 years ago. None of their kids speak to them. Their wife left them. They have no family. You're going to treat them, the patient, as an individual, just that patient by themselves outside of the realm of the family. The nurse is caring for a male patient newly diagnosed with type 1 diabetes mellitus. The patient is not adjusting well to the diagnosis and is refusing to learn how to self-inject insulin. The patient's wife is critical of the patient's refusal to learn. A small argument ensues, and the wife leaves stating, "I'll be back later when I cool off." What should the nurse do? A, ask the patient if he would like his wife excluded at visiting time. B, tell the wife in the hall that her behavior is unacceptable and cannot be tolerated. C, realize that the wife will be an important part of the therapy. Or D, tell the patient that he needs to listen to his wife more. And guys, the correct answer is C, realize that the wife will be an important part of therapy. The wife has the potential of being the patient's strongest support system. So we definitely want to include the wife, okay? All of the other choices are inappropriate. You're not going to do that. When initiating the care of families, one factor that helps organize the family approach to nursing process is that the nurse, A, views all patients as unique individuals, B, realizes that families have little impact on individuals, C, understand that individuals have a little impact on families, or D, realizes that individuals have an impact on families. And the correct answer is D, realizes that individuals have an impact on families. And that's why we always want to get the families involved when it's possible. What is the point of doing all of this teaching for a patient? You gave them pamphlets, you had the patient do return demonstration, you spent all this time teaching only to send them home upon discharge. They don't have that support of the family and they're really not being compliant the way we expected them to, okay? So we want the support system involved because that is going to encourage the patient to be compliant. The nurse is interviewing a patient who's being admitted to the hospital. The patient's family went home before the nurse's interview. The nurse asks the patient, "Who decides where you go on vacation?" In asking this, what is the nurse trying to do? 1, assess the family structure. 2, assess family form. 3, assess family function. Or 4, make a categorical generalization. And the correct answer, guys, is 1, assess the family structure. So the family structure is who does what? Each person in the family, what is their role? That's what the family structure is. Then you have, let's go over the wrong answer choices. You have B, family form. Remember, I told you family form is. That's the type of family. Is it a blended family? Is it a single family? Is it a nuclear family? What type of family is it that we're dealing with? That's what family form means. Choice C, assess family function. Remember, I told you what family function is. That's when you how well a family can cope with stressors. And there are lots of stressors in life. Family member getting sick, person losing their job, fighting with the kids, they might be losing their home, bills are coming in, whatever the stressors are, family function is how well they actually can cope with the stressors. What kind of support do they have to cope with the stressors? And of course, make a categorical generalization. We don't do that ever, right? This is misleading and we avoid these 100% of the time. When focusing on older adults, the nurse must be aware that A, elder abuse happens in lower socioeconomic classes only. B, elders have the same societal networks as younger people. C, caregivers may be spouses or middle-aged children. Or D, caregiver stress is minimal when caring for a patient. And the correct answer is C, caregivers may be spouses or middle-aged children. Now think about it. You're caring for an older adult. Their caregiver might be their spouse who's also an older adult. So they might also have their own health conditions or disabilities or, just issues going on with them, but that's the only caregiver that they have. Or remember, it's an older adult that we're dealing with. Their caregiver might be an older adult child. Okay, let's look at the wrong answer choices. A, elder abuse happens in lower socioeconomic classes only. What did I tell you about all inclusives? So we know that's wrong. We're going to throw that out. Then we have choice 2. Elders have the same social networks as younger people. That's not true. Younger people, their social networks might be people that they socialize with at work. Well, the older adult might be retired, so they're not going to have the same social network. The younger person, their social network might be social media. TikTok, which I'm on now, guys. Facebook, Instagram, where the older adult is still writing letters, okay? Excuse me. And choice D, caregiver stress is minimal when caring for a patient. No, caregiver stress is increased when caring for a patient. So C is the correct answer. When the nurse views the family as context, the primary focus is on health and development of an individual member existing within a specific environment, such as a patient's family. Although the focus is on the individual's health status, the nurse should A, assess how much the family provides patients' basic needs. B, assess family patterns versus individual characteristics. C, maintain distinction between family as patient and family as context. Or D, plan care to meet not only the patient's needs, but those of the family as well. Our priority is A, assess how much the family provides the basic needs. Because if the family's the one providing all of the patient's basic needs, but something happened, they're fighting with the patient, they're not around, how are we going to send this patient home safely? If it was a family that was that was providing all of the basic needs and they're not there anymore. So we need to know who is providing the patient's basic needs, and are they present? Are they active? When we discharge that patient home, is it going to be a safe discharge, or are we going to have to make arrangements? The nurse is caring for a patient in hospice. As she observes the family dynamics, she notices that the patient is getting adequate care, but the wife is not sleeping well and needs rest. The nurse also assesses the need for better family nutrition and meals assistance. The nurse discusses these assessments with the patient and his family and formulates a plan of care with them to address these issues. The nurse is utilizing which approach to family nursing practice? A, family as context. B, family as patient. C, family as system. Or D, autocratic determination. And the correct answer is C, family as a system. So let's look at these wrong, and well, let me talk about the right answer first. Family as a system, everybody's being involved, right? Yes, we care about the patient, but we also care about the patient's support system, because if they're not well, how are they going to take care of the patient? Okay, so family as a system, that's why that's the answer. Now let's look at the wrong answer choices. A, family as a context. Remember, family as a context is when we're treating that one individual, okay? That focus is on that one individual. B, family as a patient. That's really when we're focusing on the family processes and relationships, okay? And then choice D, autocratic determination. That's when one person makes a decision, everybody else follows. And that's not the situation, because in the question, we see that the nurse involved all of the family members and they came up with the plan together. All right, guys, and we're down to our last question. The nurse is caring for an elderly patient who has no apparent family. When questioned about his family and his definition of family, the patient states, "I have no family. They're all gone." When asked who prepares your meals, he states, "I do, or I go out." Given the three different approaches to family nursing practice, which would be most appropriate for this patient? A, family as a context. B, family as a patient. C, family as a system. Or D, combination of family as context and family as patient. And you guys know the answer because I just literally explained the definitions of each. So the correct answer is family as a context. Only that one patient is being treated. We're caring and we're focusing for that patient outside the realm of the family. Okay, guys, I hope this was helpful for you. I know lots of students that are in fundamentals or foundations of nursing, they tend to struggle with this. That's why I decided to make this video. If you found it helpful, please share my content, guys. I'm trying to get my channel to grow. I have something very special in store for you. So just hold on tight. I'll be making the announcement soon, but I need your help. Please help my channel grow. Share this content with any friends, co-workers, anyone you know studying for the boards or that is in the nursing program now. Do not forget to like and subscribe below, and don't forget to jump over on TikTok where I have different content, different videos. Thank you so much for joining me, and I'll see you on my next video.